Pathology, exam-oriented MCQs. The basic structural and functional unit of the body is cell. Which organelle is known as the powerhouse of the cell? Mitochondria. Enlargement of an organ due to an increase in cell size is called hypertrophy. Increase in the number of cells is called hyperplasia. Decrease in the size of cells or an organ is called atrophy. Replacement of one mature cell type by another mature cell type is metaplasia. Abnormal cellular growth and maturation is known as dysplasia. Programmed cell death is called apoptosis. Cell death caused by severe injury, usually associated with inflammation, is necrosis. Coagulative necrosis is commonly seen in myocardial infarction. Liquefactive necrosis is classically seen in brain. Caseous necrosis is characteristic of tuberculosis. The cardinal sign of inflammation caused by increased blood flow is rubor. Tumor in the classical signs of inflammation means swelling. The predominant cells in acute inflammation are neutrophils. The predominant cells in chronic inflammation are mononuclear cells. The most important phagocytic cell in chronic inflammation is macrophage. Histamine is mainly released by Mast cells. Which mediator causes vasodilation during inflammation? Histamine. Pus mainly contains dead neutrophils and cellular debris. Granuloma is commonly associated with tuberculosis. Which cell is primarily responsible for antibody production? Plasma cell. A benign tumor is characterized by usually slow growth and localized behavior. The spread of malignant tumor cells to distant sites is called metastasis. A malignant tumor arising from epithelial tissue is called carcinoma. A malignant tumor arising from connective tissue is called sarcoma. Leukemia primarily affects bone marrow and blood-forming tissues. A decrease in hemoglobin concentration is called anemia. Iron deficiency anemia is usually microcytic hypochromic. Vitamin B12 deficiency commonly causes megaloblastic anemia. Sickle cell anemia is caused by an abnormal hemoglobin. The abnormal hemoglobin in sickle cell disease is HbS. A decrease in platelet count is called thrombocytopenia. Hemophilia A is caused by deficiency of factor VIII. Hemophilia B is associated with deficiency of factor IX. The normal site of erythropoiesis in adults is mainly red bone marrow. ESR is commonly increased in inflammatory conditions. A decrease in white blood cell count is called Leukopenia. An increase in white blood cell count is called leukocytosis, which WBC is commonly increased in parasitic infections. Eosinophils. Jaundice is caused by an increased level of bilirubin. Fatty change is commonly seen in liver. Cirrhosis is characterized by fibrosis and nodular regeneration. Edema means excess fluid in the interstitial tissues. A thrombus is blood clot formed within a vessel. Thrombus that travels through the bloodstream is called embolus. Tissue death due to interruption of blood supply is called infarction. An aneurysm is abnormal localized dilation of a blood vessel. The study of tissues at the microscopic level is called histopathology. The study of individual cells for diagnosis of disease is called cytology. Thanks for watching.